Hey guys, happy Thursday. Welcome back to my channel. As promised, I'm going to show you guys what it is like for me every month when I have to give myself an injection. I'm going to just show you the process. It's really simple. It used to be, oh, my husband's telling me something. Okay. It used to be difficult, and he used to have to give me the injections because your brain automatically tells you like you're not supposed to injure yourself. You know what I mean? You're not supposed to self-harm, and so it's hard to do in the beginning. So I have been on a biologic, which is basically a healthier medication for people who, in my case, because we're trying to get pregnant, I can't take anything stronger than a biologic. There are other medications that I know will probably help me feel better, but I'm not in the position that I can take them right now. And I don't know how much longer I'm going to stay in the same boat. You know what I mean? Like, there has to be, my rheumatologist, every time I go see him every 4 to 6 weeks, he's like, okay, well, you know, what are we going to do? You know, like, what is the next step? Like, if we keep trying and your joints and your inflammation is getting worse, you're going to have permanent damage to certain parts of your body. And in my case, it's in my hands and my wrists. As you can see, like, look at that. See that? And see that? All inflamed. And I know that there's, like I said, there's other stuff that I could take, but I can't right now. One of the drugs that they want to put me on is methotrexate, which is, from what I've heard, it's a really strong drug, and it's actually really, really good. And it will probably eliminate all of this. And honestly, it will probably eliminate a lot of pain, but I am not ready to go there yet because we're still trying to conceive. So we're going to just stick to the biologic and a couple other pills that I'm taking every single freaking day. Also, for my sickle cell anemia, I'll show you guys what I'm taking for that too. I used to take penicillin every day. Up until the age of 18, I took penicillin every day. When I turned 18, my doctor took me off because it wasn't necessary anymore. Well, he didn't feel like it was necessary, which I agree. Penicillin is an antibiotic, and it just helps you. You might have been prescribed that before, too, if you've ever been sick with some type of infection. But it was basically a preventative measure for me. So they took me off when I was 18. And now I take a folic acid every single day. And they prescribe me pain medicine. But honestly, God is so good. I have not been affected. Like, I mean, my sickle cell is so under control. I need to knock on wood, because then watch, I'll be filming from a hospital in 2 weeks just because I'm talking about how I've had it under control. But I have been really, really good. Like, honestly, I've been really good. The only time I get sick with the sickle cell is when my blood count drops below a certain number. The average, like for a woman, your count should be between 12 and 14. Mine is, I've never been higher than 8. So I'm receiving way less. Like, my body's not producing enough whole cells. So what happens is the half cells sickle, and they get cramped in your joints and your back, and just pretty much everywhere. It can affect your brain. It can affect a lot of things. And so that is when you can go into a crisis. And a crisis is basically, it's pain. How do I describe it? It's a type of pain that goes beyond what you can do for yourself at home. Like, for me, if I could just wake up, and I mean, my day, I never know how my day is going to start. You know what I mean? I could wake up and I can have a day of a pain level from, like, on a scale of 1 to 10, like a 4, and that's fine for me. Or I could wake up and be on 20. You know what I mean? You just never know. And there's really no way to prepare for it. I know I could eat better. That will help me. But as far as the sickle cell goes, you really don't know what type of day you are going to have. And it can change just like that. I can literally feel when my counts dropped, because you have shortness of breath. You like walking from say a parking lot to a building, I will have to pause for a second. I remember the last time I was in the hospital last month, and I was like, okay, I'm gonna have to go get my blood checked, because I went to the grocery store and I only had a few groceries, but I had to take a break in between each bag that I was loading into my car. I had to pause because I was so out of breath. Well, when I went to the doctor, my oxygen level was so low, they kept me. Well, actually, I was at Vanderbilt, and they wanted to keep me there, but I really practically was like, I was just like, I would prefer to go home, honestly. I don't want to spend a night in Nashville. I want to come home. Especially, I mean, I love Nashville, but I'm not trying to stay in the hospital there. I did it once, and I love Vanderbilt, but no, I'd rather come home to a hospital here. Even though Vanderbilt has more skilled doctors. I know that sounds backwards, but their hospital is kind of outdated. Oh my gosh. It's outdated, but I love their doctors. But I'd rather come to hospital, even though they suck just as bad. But anyway, I'm rambling. Anyway, they sent me home, but they told me, like, they're going to call me the next day to check on me and to tell me whether or not I need to go into the emergency room, because they were waiting on results from a lung test that I did, which I do every year. So I was up there for that anyway. And it just so happened my oxygen was low too. Well, oxygen was low. So they're like, we need you to go to the emergency room right now. And basically just go to the ER, and they're going to admit you. You already know they're going to do that. This is what my doctor said. She was like, they're going to admit you. So just go in knowing. So I went, they admitted me because my oxygen was reading at like 70 something. And you should be at like 95 to 100. And they thought the machine was broke. So they tested Mario and a doctor, and theirs was like 98 and 100. So they're like, oh yeah, no. So I got admitted, and they only kept me for a night, which is good because normally they try to keep me longer. But they sent me, show you guys. They sent me home. They wouldn't let me go home if I did not agree to this. Hold on. I agreed to go home with oxygen. It's not necessary in my opinion. Like, I haven't even used this yet. I have one in our room that I have used just because it's here, and I not use it, but they wouldn't discharge me without oxygen. So, in that, I was like, this is too much. But anyways, I better safe than sorry, I guess. So, yeah. So, yeah, they wouldn't send me home without oxygen, so I was just like, sure, why not? And plus, it is good to have, I guess, at home, but I don't feel like I need it, but I was just like, okay. I mean, if you're going to give it to me, my insurance is going to cover it, I will take it. I mean, it's better safe than sorry, I guess. And here I noticed there are not a lot, I guess there are just not a lot of patients with sickle cell, or if they are, I think they're used to treating patients like me with pain meds. Like, you go in and they want to just dope you up, and I don't like that. So they always trip out when I go into the hospital, and the first thing they want to do is, we're going to start your IV so we can get you on. And I always have to stop them. I'm like, well, what are you putting in my IV? Oh, we're going to get you started on some morphine. I'm like, no, I don't want any morphine. Just, all I really need is a blood transfusion, and I will be good to go. But that is what they're used to, because unfortunately, the stigma behind having sickle cell anemia is you are a pill chaser. Like, patients who have sickle cell, because, and it's kind of sad because they're in so much pain. Like, I know there are some people who are in the hospital every week. There are some people who can't work. They're on disability. Like, I am blessed. I don't have that same issue where I'm in the hospital every single week, or I have a pain crisis. I've only had in my life a pain crisis that sent me to the hospital one time, because I have managed my pain so well at home. And I think that it might be a good thing or a bad thing, but my pain level the tolerance is too high. So I could be sitting at home almost pretty much dead, and I still won't go, which I'm getting better at that. I am getting better at that. Now I don't waste time like that. But they're so used to, the hospitals where I live are so used to patients coming in, and the first thing they want is morphine, or whatever that medicine they give Michael Jackson. They try to give you that too. And I'm like, no, thank you. Let's start with a little ibuprofen, which they hate to give you that too because it messes with your stomach lining. So I'll settle for Tylenol. And for me, that's all you got to do, and give me a bag of blood and send me on my way. But they're not used to that. And I even had a nurse one day. She told me, this is like 2 years ago, I was in the hospital, and she was just like, you're not like the others. And I was like, what is that supposed to mean? She was like, well, most sickle cell patients come in here and they want drugs. And I was like, did you really just say that to me? And she was like, well, I mean, I'm not trying to offend you, but, you know, most of you guys come in here and, I mean, you guys want morphine or you want something stronger and then you're good to go. And I was like, well, first of all, you don't know what it feels like. If you don't have sickle cell anemia, you don't know the pain that we go through. Like, you don't have a clue. So don't judge. And secondly, you're a nurse. Don't ever say that to me again. And don't say that to another patient. And I reported her too. And I said, because that's disrespectful. And for years, I would avoid, and I still avoid, because the stigma is, you're coming into the emergency room, oh, you're looking for morphine. And I don't even like morphine. That stuff makes me sick. Like, I'd rather you give me a Tylenol. I prefer ibuprofen, but they won't give it to me. And give me blood, or don't give me no medicine at all. Once I get blood and my counts go back up, I'm good to go. I don't even need medicine. And give me some fluids, and that's it. But the stigma behind it is so negative, I don't even feel comfortable. Even, I remember I had a pain crisis. It was so bad. It was Easter weekend. I'll never forget it. This is years ago. And I was hurting so bad. I was spazzing. I was trying to get ready for church. And I remember because my sister and her family still lived here. And I was in the bathroom, and my niece had spent the night. And I couldn't even speak to her. She was like, I was trying to put makeup on her doing something, and she was in the bathroom too. And I remember I was just like spazzing, and I was just like, and I'm still trying to get ready for church. I was like, you know what? This is not, no. That type of pain I've never experienced that before in my life. Well, I remember going in, because at the time I was living with my parents. So I was like, I couldn't even get it out, but I got it out. Like, I need y'all to take me to the emergency room, because I could not, because I had already taken medicine the night before and woke up still in pain. So my mom took me to the emergency room, and they admitted me, and I was still trying to refuse something stronger because I didn't want them to think I was there trying to get drugs. Well, my mom, and everybody who knows my mom, she does not play when it comes to me being sick. She was just like, no, she needs something else. So they gave me whatever they gave me, but I ended up throwing up because I'm not used to taking it. But I threw up like every time I opened my mouth, I was throwing up because the medicine was too strong. But it took the pain away. Within like an hour or two, I was good. But they kept me for a couple of days. Well, I'm saying all that to say there's so many. It's just really sad that there's just a lot of us out here, but not enough doctors and nurses who are familiar with what we go through. So they don't know what to do. So the easiest thing to do is to give you medicine, give you pain meds. So, and I just don't like that. So a lot of times I refuse it. And there have been times when I've been in there and I'm like, dang, this Tylenol did not work. I could be all day, and they'll come in on a scale of 1 to 10, how's your pain? I'm like, oh, it's a 2, and I'm really like about a 7. But I'm too ashamed to ask for anything stronger because I don't want them to think that I'm searching for meds. So anyway, but I've gotten better at that. Like, I had to just realize, like, if you're in pain and what your pain management that you're doing at home is not working, it's okay to go to the hospital and get what you need to get, But anyways, that'll be in another video. I'm just rambling. Today's video is supposed to be about Cimzia, rheumatoid arthritis, what I'm taking for that. We'll talk about sickle cell on another video. So I'm taking Cimzia. They send me a package every month through a specialty pharmacy, and it comes in a little box like this. This is the box that it comes in. And it comes with, I already took out the medicine, but it's just like that. And it comes with 2 needles like this, just like that. And it comes with 2 alcohol swabs, but I already have like so many of these. And it comes with Band-Aids, which I need to go get. And usually the night before it's time for me to give myself my injections, I take them out, which I did already, to get them room temperature, because if you try to give yourself this medicine fresh out the fridge, it's gonna hurt. I mean, it already hurts, but it's gonna make it hurt even worse. So what I do is I take it out the night before, and I let it sit on the counter, and then it gets room temperature, and then it's ready to go. So I'm gonna wash my hands really quick, and I'll be right back. Okay, so I'm back. I washed my hands. Oh, and I just scratched my head, but I have alcohol prep, so it's all good. Like I said earlier, this is a biologic, so it is safe to use for women who are trying to get pregnant instead of methotrexate, which I heard methotrexate is really good and it works really well. My mother-in-law's on that, and she has no inflammation. Like her hands aren't, damaged or anything. So I know eventually I will probably go on that, but we're gonna stick to biologics for at least another year or two. Anyway, let's go ahead and get started. So I'm gonna flip the camera like this. And already my band-aids. I already have, these are just some little, just in these two. Okay, already open. All right. So, you're supposed to go the fat part of your, it's easy to just stick it in your belly. It's less painful, believe it or not. It's less painful to go in your belly than it is to go, in your legs. So you could go on your legs. I've gone on my legs, not with Cimzia, but with Humira, I've gone on my legs and it hurt. But when I go on my belly, because there's more fat, it doesn't hurt. So there's a plus to not having a six-pack in this case. So this is what the needle looks like. And they always say you don't have to worry about the little bubble, but I watch way too much Grey's Anatomy for that. So I'm gonna get that bubble out. Okay, so the bubble is out. You just grab a piece of fat. I always just count to 3 and just do it. And then, so 1, 2, 3. That, and then I push it in slowly because it hurts. I mean, you could go in fast if you want to, and get it over with, but I'd rather just push it slow. I'm almost done. Whew. Okay, close the cap. And there you go. First one's done. All right. I don't know why. You know what? And you put this, of course, in the little containers that you see at the doctor's office. I have one. It's just not in here, so I'll put that away. I honestly don't know why Cimzia won't just come up with a needle for one needle, because the fact that you have to do this twice sucks. With Humira, it was one and done once a month. With this one, again, just pull it, and I'm gonna get this bubble out, even though you don't have to, but I always feel better just getting it out. And then you can always tell when you either went too far or something, because it hurts different. Like this one is stinging a little bit more. Y'all, I'm having separation anxiety. I feel like I need to get rid of my belly ring. I've had it since I was 19. But I don't want to because I feel like it's a part of me. But I'm like, okay, you're almost 40. Should I get rid of it or should I not? Some people, I feel like if it makes you feel good, keep it. But for me, I'm like, maybe it's time. And no, not the same. I haven't had the same ring since 40. I switched it out, but I'm talking about the piercing. All right, guys, so that's it. Too easy, right? So before I close this video, I just want to show you guys really quick the other medications that I do take every day. Okay, so every day I take, this is Plaquenil. I just keep it in a little pill suitcase because I keep this in my purse instead of carrying a bunch of bottles. I take this one pill twice a day. This is a pill that apparently is being used right now to combat COVID-19. So I guess there is a silver lining in having rheumatoid arthritis because I'm already taking the medicine that they're giving to treat the virus. This is prednisone. It is a steroid, which we're trying to wean off. But honestly, the steroid is probably the best thing that works for me right now. The Cimzia keeps the RA symptoms mild, but the prednisone is just, I could tell when I'm not taking it, I could tell. Honestly, the Plaquenil, I really can't tell what it's doing, but I take it anyways. I've been on this for about a year, so I just take it because I don't know, because my doctor told me to. I don't know. I can't really tell. Like I said, this is what really it works, but the side effect to this, it weakens your bones like over time. Like I've broken my back. I broke my back last year. Nobody knew it. I didn't know it. Nobody knew my back was broke. And I broke my foot. Was it? Yeah, last year. No, it was the year before last. Well, I broke my foot recently too, the top of my foot on my left foot. And it's because of this. So that's why I have to get off of it, because it's weakening my bones. And I did a bone density test, and basically my hip bones are, deteriorating. And if, like, I have bones of like a 7-year-old. And it's also causing like stuff with my skeletal system. So yeah, eventually, more than eventually, really soon, I'm going to have to get off of this. Like I don't have a choice. And this is folic acid. I've been taking this since I was like 2 or 3. Just a multivitamin. Not a multivitamin, it's just a vitamin. Anybody can take this. You can get this over the counter. It's really good for pregnant women, and even if you're trying to get pregnant. So I've been taking it since I was a kid. So, since I was probably like 2 or 3. And I'll probably take it for the rest of my life. Vitamin D, because of the bone thing. I take this, which I need to get some more because I'm almost out. I take that once a day. I take this once a day, and I hate it because I don't like chalky pills. See? I hate, my other ones were gel caps. And this is disgusting. But I take it once a day. Vitamin C, which I've been taking vitamin C. I only do this in the wintertime, but I've kept doing it because of, Corona. Take this every day. This was recommended by my OBGYN. I just take that every day. It's just a vitamin B complex multivitamin. I take turmeric, which is really good for inflammation. I take this 3 times a day. I take rhodiola. I'm trying this one. Normally, the one that I take does not have turmeric in it, but I figured it could not hurt to have extra turmeric in your body. So rhodiola is really good. It is a supplement that helps with stress management. It helps with anxiety. It's just a natural pill you can take to help with all those things. Let me read. Yeah, reduce stress and fatigue, body and joint and muscle relief. So that's what it does. And I can honestly, when I take the rhodiola, I hope I'm pronouncing that right. I feel better. I usually take that, well, I've been taking this one every day even though I'm not working, but especially during the week when I'm working, it just helps me manage my stress better, my anxiety, but it's just I could tell the difference when I don't take it. This was recommended by my OBGYN as well, because he felt like because I can't tell when I'm stressed out because my body's so used to being under stress, like physical stress. He was concerned that I did not know what stress felt like or how to manage it, or when I was under stress, I would not know. So he just decided that I should start taking that, just, for myself to manage it, because I honestly don't know what it feels like to be stressed. I'm so used to functioning the way I've been functioning my whole life. I don't know what it feels like. So now that I take this, I can tell. So you guys should really, really, really do some research on this, and you should take it at least once a day. And I'm taking zinc. I just started taking this because my sister-in-law, she's a nurse, and she told me that I need to start taking it every day, especially right now with coronavirus, going around. So I've been taking that once a day. And I also take this. I only take this when I don't do this, because they are both 1,000 milligrams. So I don't need both. So anyways, that is it for today, guys. I will do another video really soon, probably next week. If you guys want more information on the medications that I'm taking, please comment below. I keep looking out the window because my dog's outside. Comment below and let me know. If you guys want me to do just a Q&A on sickle cell anemia, I could do that as well. Comment below and let me know. Anyways, happy Thursday. Everybody stay safe, and I will talk to you soon. Bye-bye.